Hi, I am Dr. Prajwal K Rao, aesthetic and plastic surgeon working at Dr. Prajwal's Laser and Cosmetic Surgery Center, Kanyanad and Mangalore. Today we are going to discuss on breast augmentation or breast enhancement surgery. Most of the female desire for the increment of the breast size or shape. So when this ladies comes to us with this requirement, we usually suggest two types of surgery. First surgery is called as fat grafting, and second surgery we suggest is breast implant augmentation. Fat grafting is one of the procedure where we use her own fat either from the abdomen or from the inner sides of the thigh to increase the size of her breast. But mind you, with fat grafting we can only achieve a half cup to 1 cup size of increment in the breast size. So usually the benefit of this breast fat grafting is that it is completely natural. We are using your own fat products to inject into the breast. But only demerit of this procedure is that it is a time consuming, in the sense the results will be seen only after 3 months after the surgery. And second thing, it is highly unreliable of how much increment of cup size will come. And third, the cup size increment is not enough for most of the females. The second surgery which we commonly do for breast augmentation is breast implant augmentation. Breast implants are one of the commonest surgery we do in the females, where it is a daycare surgery where the patient comes in the morning and goes back in the evening. This surgery is very safe. It is done under general anesthesia, where you will be put into the sleep and there will be no pain during the surgery and also after the surgery. So breast implant augmentation involves two types of implants. One, it is called as saline implants, and two, it is a silicone implants. Usually the saline implants are used in the females who are aged less than 18 years of old, and silicone implants are used in the age after 18 years of age. The silicone implants benefit is that it is highly cohesive, where it doesn't break so easily, and it remains for long years after the breast implant. The silicone implants comes in various sizes and shapes. It can be circular or anatomical shape. It ranges from 100 cc to up to 400 cc. So based on the patient's individual and her requirement and doctor's suggestion, we choose the right size and shape of the breast implant. The surgery is very straightforward, where we make a small cut in the inferior mammary line, basically under the breast fold, or we can also take a small wound in the axillary region, which is in the axillary fold, so that the scars are hidden and the scars will not be seen after the procedure. Usually after the surgery, patient will need to take rest for a couple of days, and by end of 1 week she will be ready to go to do all other activities of her in her life. How do you choose the right breast implant for your breast? Usually the doctors will tell you how to choose the right breast implant. Either you can do two things. One, you can use something like this. This is called external breast implant sizes. This we place under your bra, and you can check for the size and shape of your breast in the mirror, so that you can choose approximately which size breast implant you would love to have in your breast. So basically this ranges, there are a lot of sizes here, size 1 to size 10. So based on that, then we can choose a breast implant. There's another method called as software system, where we use a software in a digital platform, where we can create how you will look after the procedure. So based on these criteria and based on the suggestions from the doctor and based on your desire of how much size or shape of breast you need, we choose the breast implant size for yourself. Breast implants, after doing the surgery, this can stay for longer years. Yes, there is always a shelf life for the breast implant. It usually lasts for 10 to 15 years. But usually we have seen in patients which goes for longer years after 15 years also. But in case you have some trouble or you feel like you need another size of breast implant, you can always go for a breast implant exchange, where you can increase or decrease your breast implant size at the later years of your life. So breast implant is completely safe and effective surgery to get a breast augmentation. For some people, we also do a combination surgery, where we do a breast implant along with the fat grafting, because breast implant will give you a good projection and good shape and size, but to create a cleavage, we always inject a fat grafting in the medial side of the breast to get a better cleavage. So These are the things related to breast augmentation or breast enhancement surgery. To know more about this, or if you have any doubts regarding the breast implants or breast fat grafting to the breast, you can always comment in the comment box below, or you can call us to the given number here. Thank you so much.